Another thing that I want to mention is a lack of communication, information, and a lack of professional organizations, advocacy groups that support physicians, international physicians when they come to Canada. I found that a lot of people don't know about the International Medical Graduate Association. This is the association that helped me the most when I came to Canada. One of my friends was a member of that association, so she introduced me to the association, and I started going to that association for my second month in Canada. The association is basically supporting, it consists of all international physicians who are not in practice. Once you get into practice or in residency, you are not part of that association. It's basically created to support the international physicians in the process of licensing. The association is consists of about 600 international physicians across Alberta. And I think at least half of them are qualified to practice in Canada, and they passed all exams. They've been waiting for residency positions. I don't want to mention about the number of residency positions because it's a huge issue and then ups and downs. Everything depends on the market. Again, there are years that more positions are open. When I started, that was I actually got ready to apply for residency in 2007. So I applied that year, and there were that year and the next year there were about 70 positions for international positions, which I would like to thank the government. That was excellent from the company, excellent. Now there are half the number, and I think the council took those positions further down. I'm not aware of what the reason of that. And as I said, I'm not involved right now much in the association activities at present. I also want to mention something that is, I think not very many people are aware of what's happening with international physicians. Once they get in this process of licensure and they pass their exams, what's happening with those people. I want to mention that in the first place, when we started licensing, we have excellent organizations as Calgary Catholic Society and Bow Valley College and MCAP is a Medical Communication Assessment Project. A lot of projects out there for newcomers to start. But then people pass their exams and they wait and they wait and they wait. And eventually they go into residency. What happens in the residency, I already mentioned about the challenges that we encounter with a lack of knowledge or a lack of cultural awareness, because I should tell you that international physicians are very different than the regular Canadian culture, medical culture. I don't know how it's in other areas, but medical culture is very specific. So I encounter several examples and several events that international physicians have been intimidated. They've been preceptors were aggressive to them. They were sort of bullied. And this is a huge, I think it's a huge problem, because in our society, in this multicultural society, we have to have a tolerance to each other. And we have to have our awareness that everybody deserves the position, being through the process, being licensed to practice in Canada or getting through a training program. Everybody deserves to be respected in a certain way. So this hasn't been followed, and I think advocacy organizations are important, and I believe that's in all other areas, all other professional areas. And we heard about some of the examples here as well from different professions. Language is a huge issue for international physicians, and I believe that's for everybody. And I should openly say that immigrants have their accent. They have their English as a second language. We don't speak English that as well as people who are born and who are raised here in Canada. And I think everyday English that we use in everyday life is different than the one that you use in professional life. So we're not trying for that. I personally went through the MCAP program, Medical Communication Assessment Program. Excellent opportunity. Now the funding for next year is cut down. I just recently heard about that. Again, I don't know what the reason is. This program basically taught us how to prepare for exam, OSCE exam, which is sort of a practice exam. They teaches us specific phrases that are used in medical terms and phrases that people use, for example, culture. You know, things that we don't know. We're not aware of those expressions because we haven't been in Canada. So I think this is important. And I also want to point out that the international physicians are misled when they come here. They think that, okay, my English is good, I can communicate, I can buy something, everything from the market, and I can talk to people, they could understand what I'm saying. In medical, in the professional field, it's different. And I think people get impatient when you start talking. You put words in a different way. Sentences are set up in a different way. So sometimes it doesn't make the same meaning as Canadians would expect you to say that. So I think that's something that people should think of, and organizations that would like to support professionals should have that in place. So I think I had a good experience with this issue, and I'm really trying. That's doing. So that's been already mentioned, but that's probably not the last thing that I mentioned is social isolation. So when we came to Canada, we spent years of trying, hard study, go to the library, volunteer, do observership in different medical offices. You lose your social relationship with people around. And my personal experience here is basically for the first years of my life, I haven't gone anywhere. I didn't know where boundaries, I didn't know where the masks is, and so on. So I basically stayed home, library, home university, and some medical offices. You lose your link, your connection with your society, cultural society as well. You don't know much about the Canadian culture, and you don't have a chance to establish a good connection with your personal society, cultural society. And that's a huge issue. So I think cultural awareness is important. So people who come to Canada need to know, they have to know the cultural differences, they have to be ready to change. And I want to point out that I'm not an extraordinary person. I'm just a normal, regular person. But I think what helped me, I came to Canada at the right time. I met the right people, thanks to everybody, not everybody here. But I got a lot of support from physicians, Canadian physicians here, and from the World International Medical Association. But I should tell you, I don't want to discourage people. I think there are a lot of opportunities for international physicians. I would like to disagree with you. I think there are a lot of opportunities out in the market, but everybody needs to be ready for changes and get that. So there are a lot of suggestions that could be done. I know I probably need to finish. So I have great suggestions and information that I think we have to think about giving more alternative jobs for international physicians while they're waiting to get into residency, or not survival jobs, I'm talking about medical jobs, clinical assistant jobs, excellent programs. I don't know how many of you have heard about clinical assistant program here in Calgary, and preceptorship program in Edmonton, excellent opportunity. Currently there are about 34 positions coming from the government. Also language skills. We have to think of that. And I personally would suggest every physician who comes to Canada and pass the Canadian exams be placed to work under supervision with the physician in a rural area, wherever. People are ready to do that. There's just not no process set up for it. And again, I mentioned about the professional organizations and advocacies. Those are some of the things that I want to share with you. And in conclusion, I'd like to acknowledge that since I arrived to Canada, there were enormous things being done in a positive way. I think government did an excellent job, and probably all non-profit organizations that support the process of international professionals integration. I think it's important for Canada being a multicultural country. It's important to set up this culture. Teach Canadians, teach immigrants that they have to accept each other's. Everybody should be given equal opportunities.